Hello, my name is Jade Leonard. Today is April 5th, 2023. This is an overview of the integumentary system. Here is the topics I'll be going over. So the integumentary system consists of the skin or the cutaneous membrane and its accessory structures such as hair, nails, sweat glands, and sebaceous glands. Some functions include providing a protective barrier from the outside environment, playing a role in the immune response, sensation, secretion, excretion, and thermoregulation. So all four primary tissue types are present here. There is an outer epithelial covering. There is a deeper connective tissue network. There's smooth muscle present that surrounds blood vessels and hairs, and there's nervous tissue that controls those smooth muscles as well as the sensory receptors. So going into the epidermis, this is the most superficial layer of the skin. It's a tough outer layer. It has a stratified squamous epithelium. There are four cell types present here, such as keratinocytes, which produce keratin, melanocytes, which produce melanin, Merkel cells, which detect sensation, and Langerhans or dendritic cells, which have an immune response role. Really quick, the inverse is thick skin. Thin skin comprises the majority of the body, with the exception of the palms of the hands and soles of the feet. There's 4 layers in thin skin, whereas thick skin has 5 layers, and again, only present in palms and soles of feet. So the epidermis of thick skin, the 5 layers from the deepest to the most superficial, begin with the stratum basale, the deepest layer attached to the basal lamina. It has large stem cells here, known as basal cells. It also has melanocytes and Merkel cells. Superficial to that layer is the stratum spinosum. It has keratinocytes with tonal fibrils or bundles of protein filaments. It also has melanocytes and Langerhans cells. Superficial to that layer is the stratum granulosum. Here, keratinocytes produce keratohyalin and keratin, which are proteins. Superficial to that layer is stratum lucidum. This clear layer is only present in thick skin and is not found in thin skin. And finally, the most superficial layer is the stratum corneum. This layer contains flattened dead cells that may be keratinized. So below the epidermis is the dermis. This consists of both loose and dense connective tissue networks. So the 2 layers here, the superficial papillary layer is right below the final, right below the epidermis. This has the loose connective tissue, whereas the deeper reticular layer, this has dense irregular connective tissue. So collagen fibers in this reticular layer actually extend into the deeper subcutaneous layer. So moving into that subcutaneous layer, also known as the hypodermis, this is composed of loose connective tissue with adipocytes or fat cells that serve as an energy reserve, a shock absorber, and helps to minimize heat loss from the body. So tying this into a clinical setting, I want to get into the field of cosmetology, where skin is one of the most important aspects of it. So say a client came in with wrinkles or sagging skin. Using my background in anatomy, I would understand that this is caused by damage to the collagen fibers that make up the reticular layer. So over time, the tension gets less and less strong, again resulting in the surfacing of wrinkles or the sagging of the skin. So this is just as a result of age, hormones, or extended UV radiation or ultraviolet radiation. So what I could do is I could use topicals that may treat or help to minimize the appearance of wrinkles or sagging skin, such as retinols or other topical creams that may increase blood flow and blood supply to the area, thus minimizing the appearance there. So that's just one clinical application of the integument or the skin in the field that I wish to go in. Thank you for watching.